Kern County has its first measles case in nearly 10 years. Thank you for choosing 23 ABC News at 11. I'm Amanda Gomez. Public health officials confirmed the measles in a teen who was visiting the area. 23 ABC's Carlos Correa is in studio with more on this community health alert. Carlos?
Amanda, the person who tested positive for the measles was from Europe and on vacation with her family when they happened to pass through Kern County.
She was here for less than 24 hours. They arrived on the 11th of August and left on the 12th.
The 16-year-old female with measles not only exposed her family, but may have also passed it on to hundreds of others in Kern County.
Measles is an extremely infectious disease and can be very serious. People can end up in the hospital, people can die. It can become a very serious illness.
This is the first reported case of the measles in Kern County since 2004.
The last epidemic we had back in the 90s, we had people die from measles, and so people can become very ill.
People who have not had the measles vaccine can become ill anywhere between 8 to 21 days after exposure. The measles typically begins with a mild to moderate fever accompanied by a cough, runny nose, and watery eyes. The fever often can spike as high as 105 with rashes throughout the body.
If you develop any of these symptoms, you need to stay home. Don't go to school, don't go to work, don't go to the grocery store, don't go out anywhere, and notify your healthcare provider to receive instructions.
Public health officials say if you do develop symptoms and have to visit an emergency room, then call ahead so hospital officials can protect other patients from the illness.
Most people who were born before 1957 probably had the measles and probably are protected. But you should try to, evaluate, whether you have that protection.
The recommendation is 2 MMR vaccines. Public health officials say the person with the measles and her family are no longer in Kern County. In the studio, Carlos Correa, 23 ABC.